All right, so let's talk about some things that may be contributing to your back pain. They may not be the only source or cause, but in my experience, with a lot of people that I have helped and coached in the gym and in the doctor's office, um, these have been main culprits. That when we address these, which are very simple and easy, they'd get 80% better immediately. So why not focus on these first? Um, Most people that I encountered had ligament laxity in their spine, in their low back. What that means is the ligaments, the tendons, the connective tissue have gotten longer over time because of your habits. They have gotten stretched out. That means you have too much mobility in your low back. Things are sloppy, and it's easy for your vertebrae to move around when they should have tension under them at all times. So Dr. Stuart McGill is one of the doctors that I follow, and I believe his website is called backfitpro.com. The guy has my dream job, and he gets to work with tons of athletes, and he gets to experiment on spine and cadavers, and I'd kill to be able to have that sort of job. But anyways, he talks about your back, your spine. You want to picture it like a pole in a circus tent. Now, even though your spine is curved and the pole is straight, it's the same principle. It has to be aligned, it has to be straight, straight up and down, and it can take the pressure of that tent, and in fact it needs the pressure of that tent and all the ropes pulling down on it, and it keeps it extremely stable and strong. But if you start to eliminate ropes, or eliminate all the ropes on one side, or tip the pole, it loses all of its stability and its strength in its shot. And any part of that tent in amongst itself is very weak and is not the same as the sum of all the parts. And in fact, I don't know if there's a term for it, and I don't think they fully have everything figured out how it works on your spine and all the muscles in your core, which isn't just these ones you can see. It's your whole entire circumference, all the way around, from here to down below your hip. Those are the muscles you need to be worrying about with your core to stabilize your spine. Your spine goes the whole length. You need to worry about the muscles of the whole length. When all those muscles are activated, they become stronger than the sum of each one of them individually. If you could say, just for math's sake, there's 10 muscles and each muscle can hold 10 pounds. So that's 100 pounds total. But when they all work in unison, they're able to hold much more times, many more times at 100 pounds that they should be able to hold. And in fact, at just a slight activation of each one of those muscles, they're able to hold 100 pounds. So I know that's a very rough, and if you're in the medical field, you probably just gasped at me and how crude that was, but hopefully you get the idea. So ligament laxity, the hypermobility needs to be addressed. That means when you're in acute pain and you have back problems, probably a better bet not to stretch, and especially not passive stretching. To this day, you watch an NBA game and you'll see this professional athlete performing passive stretching, which, think about that, it's passive. You're making the muscle passive. You're telling it to go to sleep, and then you jump on the basketball court and try to run and jump and sprint. You need to be doing activation exercises to wake that muscle up and tone it up and get it to do its job, and then go ask it to do activity. So passive stretching can have its place, but if you're having acute pain and you think it's ligament laxity, passive stretching, like bending over, rounding your back, trying to touch your toes, you don't need to do that. You round your back enough during the day. You probably sit like this in your car and in your cubicle. You're pushing that disc back all day long. Don't do it more. The reason why it feels good is because you're calming the muscles down, but you're just perpetuating the damage. So I will show you what you can do that will feel just as good or better and will send you in the right path to where you won't have a problem anymore. And then you can stretch like everyone else does. You could have a pinched nerve, and I'm going to show you in a minute how to tell if it's just the muscles are locked down or if you have a pinched nerve. Now, again, I'm not an expert on all this, and in fact, you probably shouldn't listen to anything I say. You should go to your doctor, and I'm just an amateur at all this. So, but take this for my story of what I did to figure myself out, and you can do your own research and figure yourself out. But if you have a pinched nerve, you need to go get that addressed. You need to find a doctor, and you need to get some help with that, because that is damage can occur on that nerve. The way you can tell is, at least for your sciatic nerve, find yourself a chair that's the right height for you, so your legs, your upper leg is parallel with the ground when you're sitting. Don't slouch, don't lean back. You want this at 90 degrees. You want good posture. Extend your leg. Pull your toes towards your face. You can't see it completely on the screen there, but my leg is straight. It's parallel with the ground the whole way. My toes are pulled towards my face. If you can't do this to begin with, then you probably have tight muscles. Anyways, go to the maximum range that you're able to do, and then try to tuck your chin towards your head. If that causes more pain anywhere in your lower body, there might be a pinched nerve there. If you're able to, or even if you're not able to, straighten your leg out all the way and it's bent or whatever, and you can't, say you can't even straighten your back and you're kind of slouching and you're kind of like this, but you're able to move your head all around and it doesn't hurt, then it may just be the muscles. You may have just really tight muscles right now. But if you think it's a nerve in any way, go get it checked out. Don't let it sit and build up scar tissue on it. Things you're doing that are causing damage to your back, you might sleep on a bad bed. You get up in the morning, your posture's horrible. You jump in your car, which folds you up in this unnatural position. You go to work, maybe it's either construction or an office cubicle, and you're either sitting again all day, slouched over, looking at a computer, or you're doing construction and you're in all sorts of awkward positions, and you're also looking at the ground all the time. You're picking stuff up, you're measuring things, and then you're on a ladder, which is putting you in the exact opposite posture, which isn't good for you either. All sorts of things during the day that don't hurt you right then, but it builds up over time. When you're sitting or standing, your head weighs about 10 pounds, all right? If it's not at the top of that tent pole perfectly balanced, for every inch forward it is, it's another 10 pounds. That your low back, way down here, those tent poles have to hold all day long. And they get tired and they get stretched out, and there's your ligament laxity. Also, they get dry because when they're under tension, they can't get proper fluids through them. So the muscle gets dry, tight, and weak. And it tightens up on you, and that's why when you stretch and touch your toes, you can get that muscle to loosen up a little bit. It feels better, but you're not addressing the ligament laxity, and you're not addressing that the disc in between your vertebrae is sliding backwards and then pushing on that nerve. So I'm going to show you some exercises to address that in a little bit. You don't necessarily need to exercise, although I do admonish that you do so, but a lot of people are afraid of the thought of exercise. So I'm going to say you don't need to, but you need to do activities that are going to activate the muscles. You can do it at a much lesser degree than what you're picturing in your head of going to the gym and the things you need to do. It only takes a few minutes or seconds at a time to do it. And in fact, I encourage people to do it multiple times through the day for maybe as little as 30 seconds. So you don't aggravate the area, but you're continuing to push blood into there, and you're waking those nerves back up. You're telling that muscle, hey, I need you to start doing your job again, and this is how we're going to do it. And eventually it'll get the message and it'll just start doing it. So I think that's pretty much covered everything I wanted to talk about on this video as to things you may be doing to cause it. We need to address things you can't avoid. You can't avoid sitting in the car. You can't avoid what you have to do at work. But let's talk about things that you can do while you're there, and things you can do once you're home or when you do go to the gym to make it even better. So let me end right here on this one, and then I'll show you some actual exercises.